Hi, my name is Corinne. I'm one of the practitioners here at My Pets Brace. With me today is Sam, Amy, and Terry are going to be helping hold Sam in place for this. I'm going to go over how to take a cast for a stifle brace. There's going to be a few things that you'll need for the casting. So we have our room temperature water, measuring tape, marker, bandage scissors, stockinette, surgical tubing, the casting tape, and we use box cutters here to cut off the cast. Before I get into casting his leg, there's a couple of things that are going to be really important to keep in mind while you're doing it. Whoever is helping you needs to make sure we keep the dog in a standing position and that we don't have that leg too flexed. We cannot use a flexed cast. That is not going to give us a good brace. So whatever you can do to kind of help keep them up, if we have to shift the weight over to this leg so they're putting it down, go ahead and do that. We want their leg in as normal a position as possible for this. So here at the office, we usually have someone assisting us holding the dog's belly up and holding the stockinette, and then the owner sitting by the head to help keep them still and in place while we're casting the leg. To start taking the cast, we're going to wet the stockinette a bit. Just squeeze out that excess water. And when you do put the stockinette on, you do want to pull that as high up into the groin as we possibly can, so we can get the casting tape as high up as possible. So pulling it all the way up there. You can see I have it like over right at his hip. That's as high up as we want that to be. We're going to put the surgical tube on the lateral side of the leg. And when we start casting, we're going to want 2 layers of casting tape on the whole thing. And you're going to put this, the casting tape in the water for about 10 seconds, kind of roll that around to make sure the whole thing is getting nice and wet. You want to make sure that you squeeze out all of the excess water before you start casting. Otherwise it's not going to stick well. And we want to start it just below the hock and work our way up. Again, we only need 2 layers of casting tape. And make sure that as you're casting that the dog is still standing in a normal position, that they haven't started to try to sit down, that their leg is at an appropriate and normal angle. So you can see that I'm kind of really trying to force this tape all the way up to the top of the groin there. Any excess tape you have, you can just cut off and throw it away. Usually when I'm finished wrapping, I'll wet my hands again to massage the tape, but what you really want to do is take your finger along the top of the cast, especially on the inside of the leg, to check and make sure you don't have any skin or fur stuck. That's going to be really important on your long-haired dogs especially. So just make sure you kind of check for anything stuck in there. So when we're massaging this, we want to mark our knee center, so at that patella tendon, and just do a little indent there around the hock and the Achilles tendon, and along your surgical tube. Since we're going to be cutting along that, you definitely want to be able to see that. I'm kind of making sure that I'm keeping his leg in a normal standing position so he hasn't turned out or started to sit down. As soon as you start to kind of feel this firming up, I'll go ahead and start marking. So we want to go along the tube and do some hatch marks. So when we cut it off, we can line it back up appropriately. Circle the hock, and again, mark your patella tendon or the knee center. So you do want to give this enough time to start to firm up. If you cut it off too soon, it's going to start falling apart. We're not going to have a good representation of the dog's leg to be able to make the brace off of. So I'm just going to give this a few more seconds to firm up here. And then I'm going to take the box cutter and cut along the tube to remove this. You don't need to put a lot of pressure on this as you're cutting. Just want to go right along the tube. pull the tube out. Take your bandage scissors to cut the stockinette. You can twist it off of their leg. It's going to be important before this fully hardens that you use rubber bands to bring this together so it hardens up in a normal position so it's not splayed open. So our important measurement is going to be the groin to the knee axis, so his knee center. That's very important for us to have an accurate measurement there to make sure that we have enough of a thigh here for the thigh band of our brace. If this is really short and squatty, we cannot use it. So we want to make sure that we really get this measurement. We're going to take the 0 up at the top of his groin here, so really as high up as you can, and bring it down to his knee center. So I've got 12. I'm going to check it against the cast, so we'll line that up. And I have just about 11 here, so pretty dang close, so this is really going to be accurate and we'll be able to make a good brace off of this. We are also going to measure from the patella tendon to the front of the hock. 15. Thank you for watching our knee casting video. Please give the office a call if you need any other tips or have any questions.